Now we are going to learn about the elastic cartilage. Some people even like to call it as yellow elastic cartilage. So first we will learn the distribution of this yellow elastic cartilage. So coming to its distribution, where all is it present in our body? The distribution. Okay. This yellow elastic cartilage, here the pinna, or the auricle, what do you call, is made up of the elastic cartilage. This is also called the external ear, the pinna or the auricle. Then we have elastic cartilages present in the lateral wall of external acoustic meatus. External acoustic meatus, the lateral wall of it. The medial wall of auditory tube. The medial wall of auditory tube is also made up of the elastic cartilage. Also, the epiglottis, it is a cartilage of the larynx, the unpaired cartilage of larynx, which is leaf-like, and the paired cartilages, cuneiform cartilage, the cuneiform and the corniculate and cuneiform cartilages of the larynx. These are all the examples of elastic cartilages. What is the beauty of elastic cartilage? Readily it gets back its shape once it's being deformed. Please look at my ear. I am deforming my ear. I can crumple my ear, but once I release, it reforms. Okay, coming back to its original shape, getting back to its original shape within seconds is the nicety of the elastic cartilage. If you see here, the elastic cartilage, it is having perichondrium, and the perichondrium is having two layers. The outer layer is fibrous and the inner layer is cellular. The inner layer is cellular. Here you are having the nuclei of the cells that are being drawn. So the inner layer is cellular layer. The inner cellular layer and the outer fibrous layer. These two are forming the perichondrium of the elastic cartilage. So both hyaline and elastic cartilage have got perichondrium. And if you see deeper to this perichondrium, you have got the chondrocytes. The chondrocytes here in the elastic cartilage are much larger in size. The nucleus is also large in size. Interspersed in between these chondrocytes, the matrix shows lots of elastic fibers. Here you are having lots of elastic fibers. The collagen fibers are reduced very much, and what you are having are elastic fibers. So the elastic fibers are small in size and wavy in pattern, which are present around the chondrocytes. Now surrounding the chondrocytes there is a lacuna, there is a space. There is a space, and around this space you have got so many elastic fibers. Basically, in the hematoxylin eosin sections, we are not able to appreciate the elastic fibers. You use a special staining technique which is called Verhoeff's method. When you use this Verhoeff's method of staining, then you see these elastic fibers bluish black in color. You see the elastic fibers in bluish black or blackish blue in color in the elastic cartilage. Are you able to follow? Thank you. So let us learn about the fibrous cartilage. This is also called as the white fibrous cartilage. Okay. So if you see this distribution of this fibrous cartilage, first we will go with the distribution, then next we will go with the microscopic structure. The distribution of the fibrous cartilage is very conspicuous. It is very clear and outstanding in case of the secondary cartilaginous joints. Now secondary cartilaginous joints are nothing but your pubic symphysis Okay, the pubic symphysis, the secondary cartilaginous joints. Also, we have the intervertebral discs. The intervertebral discs which are present. Now, where the intervertebral discs are present? Between the vertebrae. Okay, so these intervertebral discs are also a classical example of the fibrocartilage. And then we have got the labrum, the glenoidal labrum and the acetabular labrum. You know the shoulder joint. It is the head of the humerus articulates with the glenoid cavity of the scapula. The glenoid cavity of the scapula has got a fibrocartilaginous rim, and that is called glenoidal labrum. If you see the glenoidal cavity, it is having a rim. What is that? A fibrocartilaginous rim, and that is called the glenoidal labrum. In the same way, if you take the hip joint, the head of the femur articulates with the acetabular cavity. Surrounding the acetabulum, you again have acetabular labrum. And whenever you are talking about the menisci of the knee joint, what are the menisci? The medial meniscus and lateral meniscus of the knee joint. These are also the classical examples of the fibrocartilage. Okay. Now, when you talk about a articular disc, that is the disc which is present in a joint. If you see, this is one bone, this is another bone, they are forming a joint, that is the capsule. Compartmentalizing the joint cavity, you have got articular disc. Compartmentalizing the joint cavity, upper compartment and the lower compartment, you have got articular disc or intra-articular disc. That is also a classical example of fibrocartilage. Thank you. Histology or the microscopic structure of the fibrous cartilage, it's very easy. Please understand, this is the only cartilage which does not have perichondrium. There is no perichondrium in case of the fibrous cartilage. There is no perichondrium. So first we will draw. Okay, these are all the bundles of collagen fibers. These are all the bundles of collagen fibers, very thick and very dense. Interspersed between these, you have got interspersed between these bundles of collagen, you have got the cartilaginous cells which are having their capsules. These are the chondrocytes that are present. Okay, these are the chondrocytes that are present within the fibrous cartilage. So you see, these are the nucleus of these cells, and they are having their own capsules. The cartilaginous cells, they have got very thin, fine capsules. Okay, so this is how you are going to draw the white fibrocartilage. And please understand what type of collagen is present. It is type 1 collagen bundles that are present. These type 1 collagen bundles, they have got great tensile force and considerable amount of elasticity. The fibrocartilage has got great tensile force, and it is having certain considerable elasticity. Okay, thank you very much. The intercalated discs or intercalary discs, the special feature of the cardiac muscle we are trying to discuss. So when we draw the histological diagram, we see these zigzag lines. Okay, these are basically the junctional complexes which are present in between the adjacent cardiac myocytes. That is the cardiac muscle cells which are present side by side. They are having this. In fact, they are connected by these intercalated discs. The adjacent cardiac myocytes, they are connected by these intercalated discs. Now please observe, here we have got the cell membrane of one cardiac myocyte. Here we have got the cell membrane of another cardiac myocyte. And here we have got the cytoplasm. This is the dense cytoplasm of one cell, and these are the actin filaments, the ends of the actin filaments, right? So these are the ends of the actin filaments. Are you able to appreciate? In the same way, we have got, this is the cell membrane of another cardiac myocyte. So here is the dense cytoplasm. This dense cytoplasm of this cardiac myocyte is also showing the actin filaments, the ends of the actin filaments. Now, you see here, they are forming tight junctions. They are forming the tight junctions. This is called the tight junction. Okay, where the actin filaments end. The actin filaments, they are ending in this tight junction. So you able to appreciate the tight junction? Then we have got the desmosomes. What you are seeing here is the desmosomes. Now here what you are seeing is nothing but the desmosomes. So these are the desmosomes. Now what are they doing? The desmosomes. The desmosomes, they are linking the fibrils between the adjacent myocytes. See, there are myofibrils. There are myofibrils which are present in the cytoskeleton of the adjacent cells. So these myofibrils or the myofilaments are linked up. So linking up of the myofilaments is done by linking up of the myofilaments that are present in the cytoskeleton of the adjacent cardiac myocytes is done by the desmosomes. And again, these desmosomes, they are forming gap junctions. They are forming the gap junctions. So here you are getting the gap junction. Now again, we have got the cell membrane. Now is the cell membrane, right? Now you have got the dense cytoplasm. The dense cytoplasm. Here you have got the actin filaments, right? These are the actin filaments. What you are able to see. Now here you have got, what do you call them? The gap junctions. So here you call them the gap junctions. Now what are the gap junctions doing? The gap junctions are enabling the electrical continuity between the adjacent cardiac myocytes. They enable electrical continuity. Okay, because of this enabling of the electrical continuity, the entire cardiac musculature is turned into a physiological sensation. It is becoming a physiological sensation. Are you understanding? So you can understand now the intercalated discs or the intercalated discs. They are seen in the form of zigzag lines. They are present between the opposed membranes of the adjacent cardiac myocytes. Here, if you see the cell membranes of the adjacent cardiac myocytes, here is the dense cytoplasm very close to the cell membrane. Okay, this is the dense cytoplasm. In this cytoplasm, we have got the actin filaments. You have seen these are the actin filaments, right? Now, if you see the tight junction, and again the desmosome, and again the gap junction, followed by again the cell membranes with the actin filaments present in the dense cytoplasm. So this junctional complex which is present, that is the tight junction, followed by the desmosomes, followed by the gap junctions. So these junctional complexes together, they make the intercalated disc. Now what is the tight junction? What is the significance of the tight junction? It is that the actin filaments end in the tight junction. Actin filaments, they end in the tight junction. And coming to the desmosomes, what is the significance? The desmosomes link up the myofilaments present in the cytoskeleton of the adjacent cardiac myocytes. They link up the myofilaments present in the cytoskeleton of the adjacent cardiac myocytes. And what about the gap junctions? They are responsible for maintenance of the electrical continuity between the myocytes. So the cardiac musculature is turned into a physiological sensation. So this junctional complexes altogether is called the intercalated discs or intercalated discs, the special feature of cardiac muscle. Thank you.